Today we will learn about hypertension. Hypertension is a condition in which the force of blood against the artery wall is too high. Hypertension is also known as high blood pressure. Usually hypertension is defined as blood pressure above 140/90, which is the systolic and diastolic blood pressure, and is considered severe. The hypertension is considered severe if the pressure is above 180/120 systolic and diastolic blood pressure. Now, what are the causes of hypertension? Hypertension is mainly caused by renal factors and the vasculature factors. So, what are the renal factors that causes hypertension? Renal factors which causes hypertension are increase in renin-angiotensin aldosterone system, function of renin-angiotensin aldosterone system, increase in the RAS system. This causes hypertension, renin-angiotensin aldosterone system, and increase in renal sodium ions and water handling. Increase in renal sodium and water handling, and shift of renal function curve. Increase in shift of renal function curve, which is also known as pressure natriuresis because of renal sodium ions increase. Now these are the renal factors which causes hypertension. Now the vasculature which causes hypertension. Vasculature include increase in stiffness of vessels, increase in calcification, increase in endothelin causes hypertension, and decrease in nitric oxide and decrease in prostaglandin. Decrease in nitric oxide and decrease in prostaglandin causes hypertension to develop. Now the renal factors. Renal factors are affected by immunity and inflammation and heart and the brain and also endocrine metabolism. So these all affect renal factors and which ultimately lead to hypertension. So immunity which trigger renal factors are increase in neoantigen, increase in T cell or macrophages, increase in cytokines. These all causes renal factors to develop, and this causes hypertension to develop. Okay. Now heart. Decrease in atrial natriuretic peptide. Atrial natriuretic peptide actually decreases the blood pressure, but if there is decrease in atrial natriuretic peptide, then this will cause renal factor to develop and the RAS mechanism to develop, and this will cause hypertension, increase in blood pressure. And if there is a decrease in brain natriuretic peptide, this also causes renal factor to develop and hypertension to develop. And increase in cardiac output, increase in cardiac output or increase in heart rate, increase in cardiac output and the heart rate, this causes hypertension. And in the brain, if the sympathetic nervous system increase activity, this will cause renal factor to develop and the hypertension, ultimately lead to hypertension. Increase in sympathetic nervous system causes increase in blood pressure, and decrease in parasympathetic system. Decrease in parasympathetic system activity causes hypertension, and increase in vasopressin. Increase in vasopressin causes hypertension. Now the endocrine or the metabolism which causes hypertension. Endocrine metabolism include increase in the stress hormone or the aldosterone or the corticosteroids, and increase in thyroid hormone, growth hormone, increase in estrogen, and androgen or the androgen, increase in leptin. These are the endocrine or the metabolism factor which causes hypertension to develop, and the decrease in adiponectin causes hypertension to develop. So these all, the heart, brain and endocrine metabolism or the immunity, inflammation, these all the factors which affects renal factor, and renal factors include increase in renin, angiotensin, aldosterone system activity, and increase in renal sodium and water handling, and increasing shift of renal function curve. So these all causes hypertension to develop, which includes increase in the blood pressure. Now we will study about how the hypertension develops. So if there is pressure overload, atrial stretch, if there is a more of atrial stretch, and left atrium loses the atrial contraction, a loss of atrial contraction, impaired left ventricle filling, and left ventricle. These are the causes of hypertension. So left ventricle contraction, relaxation are affected. Neurohormonal activation, pressure overload, hypertrophy, contraction and relaxation abnormalities. These all causes heart failure and hypertension. So with the LVEF, what is LVEF? LVEF is the left ventricular ejection fraction, is the central measure of left ventricular systolic function. Fraction of chamber volume ejected in systole, stroke volume in relation to the volume of blood in the ventricle at the end of diastole, which is the end diastolic volume. So this is left ventricular ejection fraction. So the aging also causes hypertension. How aging causes hypertension? High fibrilloblast content and the genetic predisposition, and atrial fibrillation. These all are the causes of hypertension. Hypertensive crisis, the pathophysiology, increase in blood pressure, autoregulation failure. Autoregulation failure causes increase in blood pressure. So vasoconstriction, the constriction in the vessels, causes increase in blood pressure, which is because of increase in resistance. So this is important graph, and these are the causes of hypertension. And if the prothrombic state causes ischemia, reduced blood supply, the target organ will be damaged. Because of endothelial injury, increase in the constriction of vessels causes endothelial injury, and this causes ischemia, reduced blood supply, and the target organ damages. So vasoconstriction also causes RAS mechanism to develop, which is renin, angiotensin, aldosterone system activation. This causes ischemia and the target organ will damage. Increase in blood pressure, hypertension will be caused by this. Young onset hypertension include this is common, and up to 18% under 40 years age. BP tracks strongly from youth to old age, and cardiovascular and brain changes seen in young adults associated with adverse cardiovascular events in middle age. The problem is 10-year risk calculators not validated in this age group. No RCTs to assess whether drug treatment is beneficial. Lifestyle interventions don't last. Investigation in this hypertension include creatinine and microalbuminuria, thyroid function assess, ECG, echo if suspected left ventricular hypertrophy, and secondary causes include renal, vascular, endocrine. Additional imaging includes MRI, magnetic resonance imaging, CT scan. Okay, and the treatment will include the lifestyle changes, weight loss, diet, exercise, joint decision making and personalized approach, assess lifetime cardiovascular risk or heart age, and consider drug treatment. If BP is more than 140 over 90, systolic and diastolic blood pressure, or evidence of organ damage or increased cardiovascular risk due to comorbidities, which is increase in number of diseases.